Hello, good morning, good afternoon. My name is Michele Floriani. So great to be with you again for the continuation of Sequoia's Return to Work webinar series. I'm excited to introduce our content for you today, keep us on track, and get us generally off and going. As we always do with the beginning of these, I just want to remind everyone that when we bring professionals together and experts and folks from our community to talk about this, they're representing what they know at this moment of time, and this is of course an ongoing topic that continually evolves, and we all have our obligation and responsibility to go to official sources as they progress over time. Great agenda. So today's topic is a little bit different in both format and in subject matter than the series has been. And we've been very intentional in changing up the way the content's brought together. The last week, for example, or excuse me, last webinar was two panels, one with our partners, one with our clients, really looking at various aspects of well-being during this kind of shelter-in-place and COVID era that we're in. Before that, we had more product-centric themes, and today is going to be focused on the evolving, changing landscape of workers' comp and a lot of the obligations and strings that tie to that, and some of the ramifications tied to that as well. So different content in the same category, though, of what we're all going through and what we all need to be aware of and process together during this very unique time. So we brought in some friends, some experts to help unpack that. Our own risk management services leader, Suzette Germano, which I'll introduce you in a sec, and our friends at INSITE. So we'll start with some introductions and kind of quickly get into the content. And today's content is presented in kind of more of a seminar fashion. Like, this is really going to be the knowledge exchange and really kind of breaking down a structure of how to think about what's happening in the workers' compensation landscape. And so hopefully you'll enjoy that. You got your pad and paper out, take some good notes. Housekeeping, participants are in listen-only mode as usual. Feel free to use the questions functions today. We'll be looking at it as the day unfolds. We have structured content to get through, and that's the primary focus. But as we can see opportunities to address some of your questions in the natural flow of the topics, we will certainly do so. And like always, we'll use the follow-up on any questions that are submitted and try to get those answers in there and factor them into future content. So always love it when you guys leverage the Q&A and the Zoom feature. And so without further ado, let's get into it. I want to remind everyone that our Return to Work playbook is available for you on Sequoia.com. So go check it out if you haven't already. I know there's some people who've been part of this webinar series since the beginning, and then there's always new folks. So just want to let you know a lot of our best thinking about just what companies are going through and how to return to the workplace in a safe and smart way is in here. So go check that out. You can find it on the Return to Work page right underneath the main banner.
All right, let's begin. I'm excited to introduce the panel. First, we're going to have Suzette Germano, who is our VP of Risk Management Services at Sequoia. Excited to have her. Next, we'll hear from Anthony Poston from ESM Insights. Anthony's the CEO and risk manager, and he's going to do a majority of the content today in speaking and really translating a lot of what's going on in the landscape out there in terms of OSHA and compliance and some of the impacts on businesses preparing and reacting to that. And then we'll finish with some words from Sinead Scrosoppi, and she runs customer success at ESM. So great experts, very excited to get them into the content. So without further ado, let me introduce Suzette Germano.
And Suzette, a lot of people on the call may actually not be as familiar with our risk management practice as they are for us, our healthcare, well-being, or some of our global stuff. So could you just take a couple minutes and start with that, and then we'll get into the topic today. So welcome. Hello.
Sure. Thanks, Michele, and super happy to be able to join the discussion today. This is a topic that we're talking a lot about with our clients. They reach out in a variety of ways every day, and it's an ongoing dialogue because As you mentioned, it is definitely evolving, and on the workers' compensation front, certainly it changes state to state, day to day, almost hour to hour. But a little bit about Sequoia and our risk management services. While there are a number of Sequoia risk management clients that are probably joining us today on the webinar, this is a great opportunity to introduce others to how we help our business insurance clients with their risk management needs. And the Sequoia risk management team partners with our clients a little differently than a lot of brokers do. We work really closely with our clients to understand and assess their risk profiles, and we really focus on balance sheet protection and how best to leverage their business insurance policies to strategically protect the business. We do a lot more than just helping them place insurance. We do an awful lot of risk consultancy, risk advisory services, tons of contract review, but also looking at things on kind of a broader landscape. So topics like this and making sure that they're partnered in with some of the best people in the business, which ESM is from a workers' compensation claims management and loss control services perspective. So we're always sourcing who's got kind of the best and brightest out there and has content that is really meaningful to our clients in whatever their relative industry is, whatever the issue is that they might be facing. So we know it's working with our clients when they tell us, you know, working with Sequoia is like having an in-house risk manager, which I used to be for a long time. So it makes me feel good when we get that kind of feedback. But today I'm really glad that we are talking about, you know, workers' compensation and kind of the broad landscape. Since the start of COVID, as I mentioned, we have received truly hundreds and hundreds of questions from clients about how their various business insurance policies are going to respond to the multitude of impacts to the company related to the pandemic. And a lot of their inquiries have been related to their obligations as policyholders, how premiums are going to be affected, and how they as employers can ensure that they're both compliant with the rapidly changing landscape related to health, the health and safety of their employees, but also to other third parties that they may be engaged with. And the considerations and planning required to execute a safe and compliant return to the worksite is really, really challenging. And it's magnified when the organization employs staff in multiple states. While Sequoia continues to build resources to ensure that organizations are able to assess the health and wellness of their employees and their team, there's a lot that employers are needing to do prior to even returning their teams to the worksite. And, you know, while the site preparations related to COVID are different than what have been previously required for companies, we're really viewing the deployment of the tools that we're going to discuss today as just kind of the newest loss control remedies you need to employ to keep your staff and third parties that you engage with healthy. Benefits to organizations that do return their teams to the worksite safely are numerous. And one of the questions that we get asked a lot are, you know, when I do this, are there going to be benefits in terms of premium savings from my insurer? And, you know, based on the questions that we're already seeing insurers ask related to workers' compensation renewals, we expect the answer to be yes. So for companies who execute plans that are really robust and are well documented, we believe that there will be some offset in premium savings related to that, so kind of credits afforded under the policy. There may be other policies as well, things like your commercial general liability that may also be priced more favorably based on how great of a job you do in ensuring that you have a safe work site. You know, and then in contrast, employers who can't provide a plan that is as conservative, as robust, as detailed, may actually see higher rates. So, you know, kind of opposed to the savings, they may actually see some real negative impact. And, you know, I think as we start to go through the content today, you'll see that there are some really specific actions for employers to take. And while it seems a little overwhelming because there's so much content out there, and every day in the media there's some new directive or a new executive order or another link from OSHA that has, you know, something that employers think that they're going to need to do, I think today you're going to find that Anthony and Sinead are able to really boil that down to what are the actionable steps that employers must take, kind of what's the need to have and what's the nice to have, and then what's the difference in terms of how some of these guidances are being constructed and written, and what should you do about it. So super pleased to partner today with Anthony and Sinead. Sequoia and ESM have worked together on behalf of our common clients for a number of years, and their thought leadership and guidance in this area has been so helpful. Their consultancy and resources related to workers' compensation and all things related to loss control really have made them the perfect partner for our clients. Today they're going to discuss the various stages of reopening, safety, and Cal OSHA compliance, maybe what the differences are between Cal OSHA and the OSHA standards, and then some of the risk management tools that you're going to want to consider as you build out your plan. And as McKelly noted, we'll address questions either along the way, if that's possible to weave that in, or if you have some very specific company questions that maybe are a little bit more detailed, please do put those in the Q&A, and either somebody on our risk advisory team will reach out with a response, or we'll partner with the ESM team to get you an answer that hopefully gets you started in the right direction. And so with that, Anthony, I'll go ahead and turn it over to you, and you can take it from here.
Right. Thank you, Suzette. Thank you, McKelly and Mary Beth and Camila, who are always working behind the scenes to put this whole program together. We've got a lot of information that we're going to be covering in a very short time period. I'm going to turn it over to Sinead at the very end to kind of close out, and then she'll turn it back to McKelly for a full closeout of the whole webinar. But why don't we go ahead and move into this next slide. And I put this one in here to kind of start the conversation that COVID-19 is going to be the largest event in insurance history. And this is from the CEO of Chubb. I also just read a quote from the Lloyd's of London, which is the largest insurance and reinsurance marketplace, that they anticipate over $4.3 billion in payouts related to COVID-19 claims. So what we've seen in the workers' compensation space for the last few years, almost a decade, is very low rates. And now with all of these claims, these additional costs, we fully anticipate that those rates and those costs are going to go up. So all the more reason to have a really good safety program, not just COVID-19 related, but also a good safety program that's preventing injuries, preventing illnesses, and that ultimately is going to have a positive impact on reducing your experience modification rate or your workers' compensation premiums. So let's move into California. We're predominantly going to talk about California today, and I know we do have some callers from across the US, some in New York, predominantly here in California. And I will tell you, having worked with employers all over the nation, all over the globe, that California regulations are more stringent than most other state programs. So we're going to talk about the Cal OSHA framework today of what you need to do as an employer to bring your employees back both safely as well as complying with the new recommendations. And we're going to talk a lot about what's a recommendation versus a requirement. And as you can see here, we moved into stage 2 in May 8th, and now we're into stage 3 as of June 12th, except for Alameda County, Contra Costa, San Francisco, and then Imperial County, which is way down in the southern portion of California. So stage 3 has not yet fully come into effect for those counties, but we're flirting with that happening probably in the next few weeks. Although we say that, and now we have a new spike in cases, so things might change dramatically. But we're really going to talk about how we can start to move our employees back into a safe work environment. And I'll show you some of the statistics on why that's going to be so critical, not just from an OSHA standpoint or a CDC or California Department of Health standpoint, but from an employee standpoint, and why that's so important to help ease these employees back into the workplace and overcoming some of these psychological hurdles that we know are inevitable. So here are some California statistics as of June 23rd. And by no means are we out of this. And you'll hear the governor say that we're still in stage 1, or we're still in phase 1 of this whole COVID pandemic. But you can see here, just in the last 2 weeks, we've had over 46,000 new cases, 862 deaths. We have an increase in reporting, but the uptick in cases is really driving a lot more fear. I can say just from personal experience, having been tracking this since January, and we'll talk about the phases that we've rolled out since February, I'm tired of it. I'm just ready to get back to work. I'm ready to have whatever this new normal is. I'm getting used to wearing my mask, social distancing, but by no means can we become cavalier about this, or can we let down our guard. So you can see here the counties that are in gray are still not into stage 3 yet. We anticipate that very soon. But again, that's going to come with a lot of mitigation requirements. And then we're going to have to interpret what the government is saying. Is it a requirement or is it a recommendation? And I'll show you some really challenging terminology and what the government has put forth, and that's making it very unclear on what we need to do. So we're going to talk about some best practices, what we can do from a compliance standpoint, and then also how we can help the employees ease themselves back into this new normal, whatever that's going to look like. I know Sequoia has talked about these new amendments. They did come into effect. They were signed. They will come into effect July 1st. I just want to quickly touch on these because they are employer benefits. And you can see here the first one, classification of 8810. So if we had employees that were in a more laboring position, that were in a higher class code or a higher loss rate, if they are sitting at home and working, but they're not doing the laboring positions they had before, we can categorize those employees into that lower class code, which is 8810, which is clerical. And so that's a benefit because that will go into the calculation of our workers' compensation premium. So if we have a lower rate, then again, that's going to be a reduction in our premium. The second one is for those employees that we are paying that are sitting at home not working at all, and we're keeping them on payroll until we bring them back into the workforce, we can actually exclude that payroll from the calculation of your workers' comp. So again, a cost reduction in your workers' compensation premium. And then the third one, that COVID-19 claims, although they are accepted, they are compensable under the executive order by Governor Newsom, they're not going to impact our experience modification rate, or what we call our XMOD. Now, that doesn't mean we don't have a COVID case that we have to treat or manage. And so we are dealing a lot with employers that have multiple cases. I know we've got a lot of tech companies, so we've got open floor plans. We work with a lot of manufacturers, construction, all different types of industries. And when you have a specific case and it's affecting a department, we have to go through the process of decontamination, disinfecting, quarantine, and possibly even testing that specific department, because we need to know, either through contact tracing or actual swab testing, whether or not anybody else is affected, because we're going to have to take the appropriate steps to quarantine and mitigate them appropriately. So just some really good benefits for employers. As Suzette was alluding to when she was discussing the work comp aspect of insurance, so we're seeing these renewal questions come up time and time again now, especially from all different types of carriers. And so I'll just go left to right here. If your organization is impacted by the current environment, what is your business resiliency plan? And so we're going to talk about some specific steps on what we can do to mitigate this both now and in the future. Moving to the right, if the employer is considering impacts to the number of workforce, which most of us have, what steps are we taking during the furlough or the layoff period? I can tell you in Southern California, in particular Los Angeles, it's the most litigious city in the world, and it also has the most cases related to COVID. And so one of the big challenges is for Los Angeles employers is post-term cumulative trauma claims. So if somebody's let go, employees are filing suit against the employer saying, hey, I had a repetitive motion injury, I got an applicant's attorney, and now the employer is stuck dealing with the whole litigation strategy and trying to unravel that exposure. And it is a tough, tough job to do. So typically we see when those cases get litigated, they're averaging about $50,000 to the cost of that claim. And then it takes years to unravel that, get your litigation strategy, and ultimately come to a settlement. And speaking of settlements, I will tell you during this climate, if you do have claims, just general workers' compensation claims, and they are litigated, this is a really good time to position settlement. Applicants' attorneys only get paid when there is depositions, and they also only get paid when there's settlements. And right now, depositions aren't happening as frequently as they were because of sheltering in place. And settlements, while they're a little bit harder because of the court systems, again, they're doing their shelter in place and physical distancing and so forth. Applicants' attorney are coming to the table more frequently to find that settlement so that they can close that claim. So if you do have litigated cases, I encourage you to reach out to Suzette, the Sequoia team, and we can put together a litigation strategy to help you resolve some of those challenges more quickly than in a normal environment. Going straight down, what facility cleaning and employee protections, including PPE, is in place. We're going to talk specifically about an exposure control plan and some of the specific tools that you can use to implement and manage this whole reentry plan, as well as the new normal of what those employees are going to be experiencing on a day-to-day basis. And then the last one, this was kind of covered in the last slide, payroll estimates. So it's really important that you keep track of those payroll estimates, specifically related to 8810 or employees you've been paying that have not been working, because Suzette and her team can help put together that story so that when we go to the carrier, when we go for renewals, we can start putting those variables in, and then we can look at potential credits and cost reductions. So, you know, there's some benefits here to employers, but I'll show you there's also some really big challenges ahead of us. So let's talk about some of those challenges. Fed, state, and local requirements versus recommendations. I'm going to give you a perfect example of, in an upcoming slide, of what Cal OSHA says is a recommendation, but then they're also holding us accountable as it is a requirement. So there's a lot of confusion, but we're definitely getting smarter about this whole COVID pandemic. If you think back to January when it just started to hit the US, and then February it really started to take root. March we went shelter in place. Since that time, 3 months, 4 months have passed, and we've become pretty smart about how we're going to mitigate that and flatten the curve. Although we're seeing an uptick in cases, and we're not seeing the dramatic increase that we saw early on. So we're starting to get more comfortable as Californians, as New Yorkers, as everybody else within the US, and we're starting to re-engage with society. But again, as I mentioned, we can't let our guard down. So you have to continue to practice the mitigation steps that we're going to talk about here. One of the big challenges that I see, and we've been experiencing already, is employees have been sitting at home for 90, 120, 160 days, and they've lost some of those work disciplines. They have different sleeping patterns, different eating patterns. There's just a difference in their whole work discipline. And now we're going to take those employees off the couch and we're going to put them back into the workforce. And so we need to retrain them. We need to rehire them, reorient them to the site. You're going to have new hires that you're going to bring on, and they're not going to be familiar with your worksite procedures. You're going to bring those employees back that worked for you for a long time, and they're not going to understand the new engineering controls and the new workflows. So it's really important that we train them and we document that, because the documentation is critical to our affirmative defense in terms of an OSHA violation, a CDC inspection, and so forth. And of course, we've got so many different employers. We have 344 people on the call today. There's not one size that fits all. So what we have created is a framework for which we can then help modify to fit either California regulations, specific local regulations, or if we want to deploy that in New York, we take those blue sky laws and we moderate it or modify it appropriately. So I don't think this is talked about enough, and maybe it is because Sequoia is just amazing at everything that they do. I love the people, I love the mission, I love their values, just so happy to be a partner, especially because on the benefit side, they talk so much about some of these psychological challenges. And we are seeing this more and more. We're having this discussion internally with our own team. We're going to be asking our employees to leave the safety of their home and come back into a work environment, and they are fearful. And I can tell you, our team, myself, a lot of our clients, they're going through these psychological challenges of how do we create a program that is a clear line in the sand of here's what we need you to do. And we need you to be comfortable and come back into this work environment so we can get back to this new normal. That's a big ask because we're all wired just a little bit differently. There's a lot of anxieties, there's a lot of depression, there's a lot of challenges that we're going to have to overcome, and we can do that collectively as a unit, as an organization. So I encourage you to talk to your people one-on-ones, one-on-minis, have those conversations around what are they comfortable with, what are some of those best practices that we can incorporate into our program. And we call that participation in the safety program. So if you have a participatory culture, you're going to able to come together as a team and overcome some of these specific psychological challenges that we talked about. I alluded to the mental reconditioning and the work disciplines. We're going to have to retrain our minds, retrain our bodies. We're going to have to get back to this new normal. Hopefully there's a vaccine. We're watching the stock market and that's just all over the place because there is a vaccine and there isn't a vaccine. So until that is actually proven, we're going to have to work within the confines of what the government is requiring and then obviously our best practices on how we're going to implement these reentry strategies. For those of you that do have an employee assistance program, that's usually comes through your benefits. So again, if you don't know, talk to the Sequoia team. We're really pushing the EAPs right now. You usually get anywhere from 10 to 12, 10 to 12 free consultation calls a year. And those are great if you have some of these psychological challenges and you don't want to talk to HR. You do have an outlet and you can lean on those EAPs for that additional support. So let's go through the actual reopening requirements. So the governor had put out there the state's reopening requirements. Cal OSHA has adopted that. Fed OSHA has very similar. We're going to talk about what Fed OSHA requires. And this is going to be really geared more towards Cal OSHA, as I mentioned before. And so what we need to do is look across our organization, whether we're just in California or across the US or across the globe, but we need to prepare a detailed risk assessment. And then we're going to have to implement that site-specific plan. So what we like to create is a framework from which we can manage the entire organization, and then we have addendums maybe by site. And so we're going through this with a lot of different organizations because we have a lot of employers that have different types of exposures, from office environments to manufacturing to labs to construction, light construction. So each one of those has its own specific requirements that we have to adhere to. Once we have the plan, we need to train our employees. I'm gonna give you an example of some training later on in this presentation. But we really need to train our employees on how we can mitigate the COVID-19 pandemic. How can we screen themselves for symptoms? Sequoia has an amazing app, if you have not used it, that actually does the home health assessments. It tracks that all through a dashboard so that you can help manage those employees. So if you haven't seen that, and I've seen it, it's pretty amazing. I encourage you to get a demo. I'm gonna keep plugging Sequoia because I really love them and I'm just glad to be participating in this call. And then we're going to have to implement individual control measures and screenings. We're going to show you how we do that through some various forms and tools that you can use, you can adopt, you can edit, and you'll make them actionable for your own organization. And these three pieces on the far right are really the core to the entire mitigation program. How are we going to control it? How are we going to screen people? How are we going to disinfect? And how are we going to create these physical distancing requirements? And we're seeing a lot of social distance versus physical distance. I like physical distance because that's technically what it is. Social distance doesn't really tie into that specific definition. We want to physically keep people apart so that we can prevent this pandemic from spreading. We want to flatten the curve. Go ahead. Now let's look at OSHA's 7-point reopening guidelines. And you'll see it's very similar, only the 6th point, which is my favorite, follow OSHA standards. That's about as general as you can get. And by the way, the OSHA standards is an enormous playbook. And so for employers that have to comply with all OSHA standards, that is a really tall order. And most organizations, especially in the startup world, just trying to get our business going, try to increase revenue, try to find product market fit. And it's hard to think about all these other compliance requirements that we have to adhere to. And that's why you've got experts like us, like Sequoia, to help guide you through some of these challenges. But as you can see left to right, infectious disease and preparedness plan. Again, that's your site-specific plan per Cal OSHA. Infection prevention measures, site screening measures like we talked about with Cal OSHA. How we're going to identify potentially sick people and how we're going to isolate them. And then there's the whole decision tree. After we do identify that somebody is infected, what do we do after that? Do we quarantine them? Do they go get tested? When do I bring them back? Do they need a doctor's note? So there's that whole after fact of what happens if somebody does get infected. And I've got some examples I'll show you here. We need to communicate about workplace flexibilities and protections. So a lot of us are remote work. You can see most of us are working from our house. So there is a whole OSHA standard, 5110, that requires employers to manage repetitive motion injuries. Well, guess what? Our home offices are now part of the work site. And so we have to work with our employees on creating those exposure control practices related to repetitive motions. So ergonomics, how we train our employees on ergonomics, how are we setting up their workstation at home to make sure that they're not going to have that repetitive motion injury, which takes anywhere from 3 to 6 months. And an example of that, we have an employee that tripped over their dog while going to the bathroom from their home office, and now that is a compensable claim under workers' compensation. So there is a whole spectrum of challenges with this extended work site that we now have to manage. Then we talked about workplace controls. Again, my favorite, follows OSHA standards. I'll give you an example of this in just a second. And then OSHA put together a risk pyramid. And what they did was they categorized employees very high, high, medium, or low. And they expect employers to identify those specific departments that are categorized towards those different levels. We're going to give that as an example here in just a second. Let's talk about some of the California Department of Public Health and the Cal OSHA industry guidances. And so this is a list of all of the different guidances or checklists that the California Department of Public Health and Cal OSHA put out. All of these are links. You're going to get the copy of this so you can click onto each one of these. That'll help give you guidance on what you need to do from a checklist standpoint to complete. And so I took this small bullet point. You see the call out there. Cal OSHA says we strongly recommend cloth face covers. And then the governor is saying it's a mandate. You have to wear it. So this is where it gets really blurry on, is it a recommendation or is it a requirement? And so this is where we as employers need to define what is going to be acceptable for our organization. And this is where we can use the OSHA risk pyramid to say, majority of my employees are at the low risk category, majority of them work from home. So we don't have to recommend face covers when they're working from home. But when they do come into the office, when they go into a conference room, if there's more than 3 people, we do require face masks. Or if you're going into an office, or if you have a big open workspace like many of us do, then maybe it is a recommendation that you have those face coverings until you leave your desk, kind of like what restaurants are doing now. You can go into a restaurant wearing your face mask, but as soon as you get to your table, you can take it down because else would you eat? So again, these changes are constantly in flux. So this guidance for office workspaces, strongly recommended cloth face covers, came out a week and a half ago. And then June 18th, actually 2 weeks ago, and then June 18th, the governor said, now we have to wear face masks, both indoor and outdoor. And I'm going to talk a little bit about that here in the upcoming slide. So I've gotten this question a lot. Can an employer force employees to wear a face mask? And the answer is yes, you can. Now, do you want to? Do you have to? That's up to interpretation. And so you can see here, I won't read through all of this, but I will tell you the mandate is anybody over the age of 2 or has pre-existing conditions must wear a face mask. Now, what do we do when we have these employees within our own confines of our facility? That is going to be up to us to interpret. And if you don't have a safety committee or you've created a COVID task force team, which I highly recommend, you can start to work through some of those requirements that we are going to establish as we bring these employees back to work. It's totally dependent on your organization, your culture, your current safety practices, your mitigation steps. So I can't tell you black or white, this is what you need to do. It's going to be something that you're going to have to define internally. But what OSHA did do, which was helpful, is they created this this little safety tip on the far right. They actually have it in 16 different languages now. You can see it if you click on that link down below, you'll be able to go there. Not during this presentation, but when you get the slides. But they have 7 steps to correctly wear a respirator at work. And so I encourage you to take this document and train your employees on it. And this is an important safety training that you have documentation on. Because when employees come back to work and they say, hey, I wasn't trained on how to don and doff a respirator, you can use this as your affirmative defense to say, yes, we trained you. Yes, we've established a face cloth policy. These are the requirements. You must adhere to them. And then I'm going to show you in an upcoming slide the number of complaints that have come out of employees to OSHA. And you're going to need to lean on that documentation to help defend yourself because unfortunately in California, as an employer, you are guilty and you have to prove your innocence. So it's very important that we have the documentation, we have a good plan. From Cal OSHA's perspective, if you didn't document it, you didn't do it. So all the things that you're going to do, make sure that you have documentation to prove it. So as I mentioned, employee complaints. There's been over 19,750 OSHA complaints. This was almost a week ago now, so it's probably well over 20,000. Employee complaints to OSHA related to employers' lack of COVID-19 mitigation strategies. So what this does is open the door for OSHA to come in and audit an employer's facility. Now, they are not staffed to do that, but I will tell you Assembly Bill 1804 and 1805 was enacted January 1, and it made a bigger OSHA. There's a $17.5 million boost to their budget. So we have a bigger enforcement division. There's 2 sides to OSHA, consultation and enforcement. And it's the enforcement that got funded. It wasn't consultation. So now we have a bigger OSHA enforcement office. We have a big number of OSHA complaints. And this is the #1 way that OSHA actually reaches out to employers to conduct an audit. Remember what I said about Fed OSHA's requirements. If you have to follow OSHA standards. So not only you have to focus on your COVID-19 mitigation practices, but you also have to follow the other OSHA standards from repetitive motions, personal protective equipment, bloodborne pathogens, hazard communication, fall protection if you're working at heights. So the list goes on and on and on. And I'll show you an example here coming up about how an employer got an inspection and then got 9 citations totally irrelevant to the actual inspection that they were out there to complete. So OSHA's stepping up their inspection and enforcement procedures. We've got this whole reentry plan that we have to adhere to now. OSHA's got their specific COVID-19 plan. When this first started in February, it started with the infectious disease and preparedness plan, which is a combination of bloodborne pathogens and aerosol transmissible diseases. And that was mostly geared towards healthcare. Fast forward 4 months, and now OSHA has a specific COVID-19 plan that we have to adhere to. As we talked about, insurance carriers are having their work comp renewal questions. They also check for OSHA violations. And so OSHA violations are public record. So when an underwriter is evaluating your insurance for renewal, they're looking for OSHA inspections, OSHA violations, and those questions will come to the table on what are you doing to resolve that. And the reason why they're looking at that is because they don't know if there's been a major claim that's happened that yet has not hit the loss runs. And so they're trying to protect their own risk and ensure that they have accurate loss data before they can issue a renewal. and this is a big one, and I'm dealing with this with 2 employers right now. They both have OSHA citations, not related to the actual inspection that the enforcement officer came out to inspect. But both of these, the employers said, well, we'll just pay the penalty. And the problem when you just pay OSHA penalties, it's a civil penalty. There's no insurance coverage for it. You're basically admitting guilt. And so we really need to have more of a defense to say, we have the policies, we have training, we've prepped our team, and therefore we can abate or minimize some of the citations, because if we don't and we just pay the citation, that's an admission of guilt. And if that claimant, let's say it's an injury, that injured employee gets an applicant's attorney, they file a case, they can file a serious and willful against the employer. And those are extremely expensive. They're challenging. So the best way to mitigate all of that is by having a good defense strategy, which is your safety program. We talked about how to have written OSHA policies. So why don't we go to the next one here, and I'll show you an example of an employee that fell off a ladder. And quick backstory, employee's been with this employer for about 8 years, fell off a ladder, climbing up on the 3rd rung, fell back, hit his hip, hit his head, taken by ambulance to the emergency room. There is a definition of serious injury by OSHA, and it includes inpatient hospitalization. If you send an employee to the emergency room and they get treated and they get released that same day, that's considered medical observation. It's not considered inpatient hospitalization. The second they go past the emergency room and they're admitted to the hospital, that is inpatient hospitalization, and that triggers the serious definition. And that is when you have to call Cal OSHA within 8 hours of that time happening to let them know that this serious injury has occurred. If you don't call them, it's a $5,000 fine, and they will come out and do an inspection, and it's not going to be consultation, it'll be enforcement, because they will come out and they will look for not only the penalties associated with that claim, but they could also look for criminal activity as well. We've seen that quite a bit. So here this employee had pre-existing conditions that the employer didn't know about. He had seizures. Employer didn't know about it, and had he known about it, he wouldn't have put the employee on the ladder. So anyway, this all comes out during the investigation, and the claim inevitably gets denied by the carrier. But meanwhile, OSHA is conducting their inspection, and they cited them for these specific 9 citations. None of it related to ladder safety. They never even asked about a ladder safety program or ladder training. It was all OSHA other standards. So as I mentioned, follow OSHA standards, because when OSHA comes out, the door opener is COVID. The door opener is having an injured employee with a serious injury. And when they come out, you've got to have some documentation in place to prove that you have established a good safety program. And I can tell you, it has been a nightmare to deal with these 2 OSHA enforcement officers. One of them is requiring, he's demanding that the employer provide him with a list, a roster of all employees in the manufacturing plant, and their personal phone numbers and their personal emails, which is a total violation of privacy. But he is demanding it so much that we had to get an attorney to step in and start to diffuse some of the situation. So again, OSHA's got a badge. They're out in force. They can shut your shop down. Now that we've got 19,750 OSHA complaints, it is time to make sure that you've got a good safety foundation and you can lean on that, starting with your COVID-19 exposure control plan. Okay, so it's here. We're getting back to work. Let's go through our reentry framework and start talking about specific steps. So now that I've scared you into taking action, let's talk about what you can actually do in order to mitigate some of these steps. So we put together a 6-point strategy. We've got our business reentry checklist. If you have your COVID task force, if you have your safety committee, or you just have a general committee that you can start to lean on for COVID-19 mitigation practices, start to establish a reentry checklist. And I'll give you some examples here in just a slide, upcoming slide. Then we're going to take that checklist and we're going to start to refine what our exposure control plan is. It's going to be site specific, and then we might have addendums for other properties or other locations. We're going to establish our worksite cleaning protocols, our social distancing or physical distancing protocols. We might have some new engineering controls. We might move desks around to accommodate 6 feet. If you go to restaurants now, you can see it's every other restaurant to establish that 6-foot distance requirement. And then we have our reopening strategy. So we're going to get ready to reopen. And then in our reopening strategy, we've got 6 specific steps that we're going to take, which is going to be taking it a level down and the actual implementation practices for employees. But first, we got to get ready. So let's go ahead and talk a little bit about our exposure control plan reentry checklist. In fact, let's just go to the next slide and just talk specifically about that. I know we're under the gun on time, so I'm going to move through this kind of quick. Now, here are some specific reentry questions you can ask. As I talked about, establish a COVID-19 task force. Start talking about these specific things that we're going to discuss in these upcoming slides. If you have high-risk individuals, pre-existing conditions, people over 65, maybe you can put them into a lower risk exposure area. Maybe they can keep working from home. I had a conversation with my mom today. We were supposed to go visit her for the 4th of July. And now she's a little worried about the uptick in COVID cases. And so we're starting to rethink whether or not we can actually go visit them. So you got to be mindful of these folks that might have pre-existing conditions, and also take action to not just identify them, but help protect them. As you can see here, PPE, social distancing, daily home health assessments. If you own your own facility, maybe reconsider the frequency of air filter replacements, and we'll talk about sanitization. Now on the right side, we've got policies to review. So as I mentioned, employees are coming back to work. They haven't been at work for a while. If you're in a more laboring position, good time to revisit the job description. Here are the physical demands of the job. Are you fit for duty? Are you ready to come back to work and lift 20 pounds and twist and turn and push and pull? Those are really important questions to ask, because we don't want to have strain and sprain injuries that pop up on our workers' compensation loss runs when we could train our employees on the whole rehire process. If you don't have an IIPP, you got to have one. It's a requirement of every employer with 10 or more employees in the state. That is Cal OSHA's #1 program that they ask for on any inspection. Code of Safe Practices is really more the 9th element to the IIPP, which is 8 elements. It's mostly geared towards construction, but we roll it out for every type of employer, because it's good to identify all your loss leaders throughout your organization, and then mitigation practices on how you're going to prevent those injuries from occurring. We'll talk about daily home health assessments, social distancing, general health and wellness training, and on and on. But you can see here's a checklist that you can use to just start going through to make sure that you have this documentation in place. And then we'll talk about the rehire process in that coming slide. Okay, so now step 2. Now we've started to identify what our exposures are. We've got our plan. We're going to formulate that into an exposure control plan. And here's one that we have prepared for the general industry. There's one for construction. We've got one for property managers, janitors, and so many other industries. But here are the specific responsibilities under that plan, and these relate back to what OSHA's requirements are. Who's responsible? How do we identify the exposure classification by department? What procedures are we putting in place to mitigate this? What controls do we have? What transmission controls do we have if somebody is infected? How are we going to compartmentalize them and isolate them and get them healthy and make sure that we're comfortable bringing them back to work? And then you can see the list down here: temperature screening, visitors, decontamination procedures, workplace controls, and PPE. We're going to talk about some of these here in coming slides, but this is, again, your framework that you can start to gauge whether or not you're ready to bring these people back from a compliance standpoint, and then also a best practice standpoint. And to self-plug, we've actually created an entire module for employers to do this. And you can see in the backdrop just the structure of how it works. We've taken CDC requirements, we've taken OSHA requirements, and we plug them into a module that we can use to roll out the team, train the team on what these new exposures are. And that starts the process. We train them, and now we're going to start doing the actual implementation, which would be social distancing, physical distancing, engineering controls, and so forth. So we'll keep moving forward here. I want to quickly plug INSITE. It is a partner of ours, and they are a fantastic organization that helps for a lot of our customers. They are a team of paramedics. They're mobile. Prior to COVID, we would deploy them out to organizations that had a lot of first aid injuries. Rather than sending the employee to the clinic, we bring INSITE to the facility. You help control some of those variables. Rather than sending the employee off, you don't know when they're going to get treated, what the doctor is going to be like. You don't even know what the clinic is like. And I've been to a lot of clinics, and some of them I wouldn't send my family to. So when you send an employee to that type of clinic, you're setting the tone that you don't really care. What I love about INSITE is they come to your facility and they treat the employees with first aid injuries. And I've seen some pretty extensive first aid injuries. And by the way, you probably see my thumb. I'm a safety guy, a risk manager, and I was cleaning a vegetable slicer and I sliced my thumb and got 10 stitches. So everything I'm saying, I try to practice, but it doesn't always come into reality. So fast forward to COVID, Virginia, who's the CEO, she laid off 135 employees in the Bay Area because they were mostly construction driven. But then she got the county health department that said, we need a JSAS, which is a job safety accountability supervisor. She rehired the 138 employees, trained them on COVID-19 testing. And now what we're using INSITE for is for manufacturing, construction, and other industries. If there's an employee that is determined that they have COVID-19, we don't know if the department's infected. So we can send INSITE out to test the department. They've got tests. They were able to get their hands on them very early. So we can swab to see if anybody else is infected. While that's happening, we're disinfecting that department because we've siloed it. And so as we disinfect that, employees go home, they get tested. If anybody's negative, then we can bring those employees to go back to work. So this is what I mentioned before about it. We were really fearful of all of this, but now we can implement specific procedures. We can lean on resources to help us mitigate the potential increase in infections. So I really love INSITE. I encourage you to, we've got their contact information there. I encourage you to contact them if you need help, or contact us. We can help get you engaged. Here's the OSHA risk pyramid. So here's the exercise that I mentioned. Very high, high, medium, low risk. So look across your organization. Do I have any employees that are in the very high category? And if you're in healthcare, you probably do. The high category I equate to somebody who's working at a hospital, maybe as a contractor. Maybe a construction company is building a new wing, or maybe you're developing an app and it's focused on healthcare. You might be closer to the source of the infections. So it's going to be a higher risk category. Then you can identify what the risks are and then what the PPE is required to keep that employee safe. Medium and low is probably where the majority of us live. Medium could be if you are a delivery company delivering your products to a retailer. They're going out into the general public. You don't know what the exposures might be, so we got to put some mitigation practices for those drivers, for example. And then low is going to be the majority of us. We're working from home, or we're working in an office environment where we can really control the variables, and we can also minimize the risk and the spread. So I encourage you to use that as an exercise with your team. Step 3, worksite cleaning procedures. So as we've talked about, sanitation, disinfecting, very important that we have a process for that. You can see here we put together a daily safety and health cleaning inspection form. You can decide on whether or not it's daily, but at least have some type of frequency towards cleaning, maybe doing a deep clean before the employees come back. If you are renting a space and your property manager is providing the janitorial services, talk to them about what their sanitation practices are. I have some employers that work in an office building that told their property manager that they'll handle it internally because they didn't want that third-party janitorial company to come in and possibly just spread an infection around. So again, here's some worksite cleaning procedures that you can start to consider. And here's a form that you can use to double check because you got to trust and you got to verify that you've actually completed the process. And then that is your documentation in terms of an audit. We'll keep moving forward here. Social distancing protocols. This was a form that was actually provided by Contra Costa County, and then all the other Bay Area counties and a lot of California has adopted this or a version of it. So this document, we've translated it into English and Spanish. You can fill this 2-page document out and it identifies what your social distancing protocols are. You then post it on your front door. And then you also train your employees on what that is. And I put together a signature page after this. So when you train your employees, and now you have documentation of your social distancing protocols and your employees have been trained. We're gonna keep moving here. Worksite controls. So if you created engineering controls, maybe you've moved desks around, you've got administrative controls on how you're doing the daily home health check and assessments. I'll give you a quick example. I went to a grocery store, I stood outside, they had red tape marking the 6-foot distances. They had a person working in the front and a person working in the back controlling the traffic. So when some person left, another person came in. So I get to the front, I got my mask, my gloves, I'm ready to go. I go into the grocery store, I go straight to the aisle where I know my products are. And as I'm walking down the aisle, I'm getting all these dirty looks from customers that are walking towards me. And at that point, I realized that there was one directional traffic flow that they wanted you to follow. And they had red tape with arrows pointing where to go. And so even me as a risk manager looking for that stuff, I missed it. And I thought this was a great example of good worksite controls, but failure on the training. So don't expect your employees to come back to work and know where things are or know what you expect. Make sure that you train them and that you document them. And that was just a really eye-opening experience of, we've got to put these great plans together, got to make sure people know what they are and that they adhere to them. We're going to keep moving here. Step 6. Before we get that, yep, we can go back to that last one. I curated some CDC posters, and here we've got the don and doffing of respirators. If you have somebody that's actually cleaning potentially contaminated areas, here's how you don and doff, a sequence of removing PPE. This feeling sick one in the middle, I've actually seen this posted a lot around town. So I encourage you to post these posters throughout your facility to raise the awareness. And also when you reorient people to your site, point them out. Make sure that they know, hey, if you're feeling sick, stay home. We can handle that. Make sure that you clean your hands thoroughly. Health and hygiene is really important in this mitigation requirement. And then stopping the spread. So this is how we're going to implement this stop the spread mitigation approach. Let's go to step 6 and a safety reboot. So Let's jump right into these. We're going to go through these. I've talked a lot about most of these throughout this presentation, so we're just going to go through pretty quickly. The rehire safety orientation, as I talked about, reviewing your job descriptions, reviewing your IIPP, if you have a code of safe practices or you have an employee safety handbook, and then review your exposure control plan. This is at the administrative level when you bring employees back. Train them on these policies, and then you're going to send them out to their department, and that department manager is going to have their own SOPs or job safety analysis or PPE requirements, social distancing requirements. Require your department managers to train the employees on what they expect within their department. So you've got two levels. Make sure you've got your administrative level checked. We talked about all those requirements, and then we send them out to the department, and then we've got our checklist there. That is how we're going to overcome some of those psychological hurdles, that we have a good plan, that we're implementing it. Well, let's go to the next one here. We've taken all that, we've created a rehire onboarding checklist. So this is a great tool that you can use to reorient your employees. Here's the things that I need to train you on, sign off that you've received them. So if they go to complain with OSHA and OSHA shows up, you can say, look, I've trained my employees on all these mitigation practices. Here's all my implementation strategies. Chances of employee getting sick at my facility is way less than them going to the grocery store or socializing with their friends, which we know they're doing. So again, you want to document all of these procedures that you have and make sure that you get signatures, because that is your affirmative defense in any type of audit. The daily home health check, I'm going to skip over this because if you're a Sequoia customer or if you're not, you really need to look at what they have in place. They've got a great mobile app that actually does this for you. You answer the questions and then it creates a dashboard of managing all the employees and their health. We talked about the cleaning inspection form. So implementing this, making sure that you are disinfecting, that you have proof that you're disinfecting, and that you're continuing to sanitize to disinfect the entire facility to keep people safe. PPE, we talked about PPE. We actually prepared another personal protective equipment document on the left side here, from hand hygiene to respirators to if you have to wear gloves. We're making gloves available to our team if they'd like to use them. Trash bins, if you have touchless trash bins, even better because you can get rid of the contaminated waste without having to touch anything. We talked about OSHA respirator training and the CDC PPE sequence of training. So PPE is a really important piece. Along with, now that we have them back, we've trained them on PPE, they're healthy coming back to work. Now we have to recondition them to the site, reorient them to the site if we have the new engineering controls in place. So again, as we kind of move through this entire process, you can see the underlying themes are social distancing or physical distancing, rehiring using policies that we've established related to COVID-19, our exposure control plan, and then sanitation efforts. And those are really core to the whole foundation of your program. And then the last one, we put together some additional safety training, safety reboot, back to work, physically preparing, mentally, emotionally preparing, and then also just getting back to establishing a really good safety routine and having a good attitude. And that's going to be really tough. The psychological hurdles are going to be very large. So we need to have these good strategies to get them back to work. And then why, just to kind of end my piece, compliance with Fed, state, and local requirements are extremely important. We're trying to flatten the curve. We've got an uptick in cases. We've got to get people back to work. And then we also want to make sure that we keep the communities that we serve safe, satisfy our insurance renewals. And most importantly, it's just the right thing to do to keep people safe. Sinead, I'm going to throw it to you for a quick closeout, and we'll throw it back to Michaela to finalize.
Perfect. Thanks, Anthony. So as you can see, navigating through COVID-19 has been confusing for some employers because we've never experienced this. So when COVID hit and shelter in place became a reality for all of us, we received many, many emails, calls from existing clients and new clients wondering, what do we do next? So we have an amazing online SaaS portal. It's called INSITE, and it's a great tool for our existing customers that are already using it to manage their workers' comp and safety program. And this portal now includes materials that will help them to be compliant with the COVID-19 process. So our INSITE portal has a robust compliance library. I'd love to say that I could tell you how many pieces of content are in there. There's probably 1,000 and growing, and we continue to add to it. So there's content, forms, best practices, programs, everything that an employer would need to be compliant nowadays. And all of these pieces will act as like a framework. So I always tell our clients, it won't hurt our feelings. You can go in there, put your logo on them, change them, make them effective and useful for your organization. In partnership with Sequoia, we've leveraged our INSITE portal just as an effective way to ensure compliance for all of these areas. You can see we now have 4 new compliance libraries, our exposure control plan, work from home ergonomic plan. We have a complete return to work strategy. And of course, Governor Newsom's executive order. We go through all of it and have everything in there for you to reference. And each library has everything that an organization will need. We've made it even simpler. So now everyone that has INSITE access will have tasks. So we've broken them out into these weekly tasks to make it very manageable for all organizations to get things on track. Now you may have things in place already. You may want to revamp it. And then you may also want to add to your existing programs. So all of these tasks are broken up into, as you can see here, weeks. So we have the exposure control plan, which we're focusing on week 1. I always say it won't take an entire week to do this. It can just take a few hours if you have the time to dedicate to do it. But if you wanted to do it weekly, you definitely can by following these steps. Second, we have a remote work plan. So lots of employees are working from home right now. Some employees never worked from home before. So really making sure that you have a plan in action for them is important. And here are the steps to make sure that you're compliant. Your IIPP, so your injury and illness protection plan, and then also heat and illness protection plan. These are the 2 main plans that OSHA is going to ask for if they come onto your site. So you want to make sure that they are up to date, they have everything in them that you need, and these steps here help you comply with that. So next steps, what do you do? So obviously get your tools and documents in order. Work with Sequoia, you can link with us. We can give you a demo of our INSITE portal if you wanted to see what we have and what we offer. Once done, obviously review all of your new protocols and procedures and implement and train your employees with these new policies and procedures as well. Get their signatures and document, document, document. That's the biggest thing. If you can take anything away from this webinar, just know that you need to have your documents in place, because if you didn't document it, OSHA doesn't think that you've done it. So make sure that that is in order, because if it is, you're compliant and you're ready to go. And with that, let's get back to work. So obviously I'm going to close out because I'm cognizant of time right now. So I'm going to turn it over to Michele to close out.
Thank you guys for going through that. Lots of good stuff. Really appreciate it. And Suzette, thank you for spearheading this with Mary Beth, as Anthony mentioned earlier, just to get this all this expertise in 1 hour webinar. So really appreciate that. Just to close off and keep it going here on the Return to Work webinar series. Our next one is actually going to be focused on the Sequoia Tech program, which some of you are actually on the call today I know are part of the Sequoia Tech program. There's been some exciting announcements around the program for 2021. This is our kind of pooled healthcare bundle, but it comes with a lot of really good stuff. It's a package designed for tech companies, and it's really increased its relevance and its focus with the breadth and the focus it has on well-being that comes pre-packaged, and you can actually even add bundles on top of the Sequoia Tech program. The reason we're going after it as a webinar topic is to really, because we see it being a really nice solution for what companies are going through right now, and there's a lot of people interested in it. So we said, hey, let's talk about it in this forum, help people understand how it could be an alternative if it fits for your company. It's a pretty good alternative for finding a really affordable way to take care of your people during this time. And of course, it plugs into the Return to Work program. It actually, in 2021, comes with the Return to Work software, as well as the other well-being bundle options. So people are interested in it. We're going to dig into that on the next webinar series, and so you can go sign up for that on the same page as always. And just in closing, again, this whole series has been such a cool example of how our community is coming together to go through this together by finding great experts like Anthony, Sinead, and our own risk management team to come be part of the discussion. As I said last time, we involved clients and partners, and we'll continue to do that. It's been really an effective mix. So thank you guys today for being part of the episode. Thank you all for listening in. We're looking forward to being with you again soon on the next webinar, and have a great rest of the week and the weekend, and be well. Thank you.